So, morning, everyone. I'm delighted today to be talking to Oonash Smyth, who's the CEO of Skills for Care. Hello, Oonagh.
Morning, John.
I'm particularly interested, Oonagh, in the recent report that came out, the state of the adult social care sector and workforce in England, because it's so relevant to the work that we're doing on our Healthier Working Lives programme. Could you maybe tell us a bit about why you've done this report, why you think it's important, and why particularly now it resonates?
Yes, of course. So we do this report every year. It's gathered from 600,000 individual records that we have on our adult social care workforce data set, which is an absolute researcher's dream. And it covers about half of the workforce, and we've been doing it now for over 10 years. And the report gives us really rich, broad and deep analysis, and it helps us get a picture of the adult social care workforce. The ONS last year said that it was the most comprehensive available source of workforce statistics for adult social care. And I say that just to give a sense of the robustness that sits of the data and the analysis. And why we think it's important. So I suppose Skills for Care, we're the strategic workforce development and planning body for the adult social care workforce in England. And we really believe that people working in adult social care are key to good lives in all of our communities. And so in order for people to live good lives, we need to have the right number of people with the right skills and the right values working in social care. And this report influences policy decisions. It highlights trends over a decade to give us a sense of the long-term and the short-term issues. I think it particularly resonates now because we know that there are some real demographic opportunities. We often talk about demographic challenges. Well, I'm delighted that I'm going to live till at least I'm 120. But we know that that means that we're going to need a lot more people working in social care in the future. We're not all living necessarily healthier. And so we need to be recruiting new demographics. We need to really keep the skilled and values-based staff that we have. And in our report, we identify that if nothing else changes, we're going to need about an extra 440,000 new posts over the next 15 years. And that's one of the reasons that we've announced that we're going to do a workforce strategy, and maybe we can talk about that at some stage.
We'll do that. Let's talk about that at the end. One of the things I just wanted to say, there's always a great danger that people think that the care sector is a drag on society. And actually, one of the fascinating things that I read in your report was about the contribution, the GDP contribution it makes to the economy. And I don't think people realise that. And I think that's an interesting one, that a perception shift that might be a positive thing to change, actually.
I think you're right. There are huge misunderstandings of social care, and that is one of them. So social care adds about 56 billion to the English economy every single year, and that's an 8% increase in 22-23. It also employs 5% of the total English workforce. So this is more than the NHS. And so when we hear this narrative that, social care is a problem to be solved, or, it's really difficult to attract people to come and work in social care. Well, we attract about 420,000 people every single year to work in social care. That's more than the population of Bristol. This is a really powerful sector with loads and loads of opportunity. And, within that, you have all the opportunities that you would have in any large sector, procurement and finance and digital, as well as supporting people every day in all of our communities. And one of the reasons that social care has such an impact on the economy, it is a lower paid workforce, unfortunately. But then what we know is that people are then more likely to spend all of their wages in their local economy, as opposed to putting it in a savings account or putting it in an ISA. And so it has a really direct impact on people's lives, on our communities, and on the economy.
Sure. Well, we could maybe follow that up another time, but I think there's something really compelling about telling that narrative and how you can shift the current perception on its head and change it. But as I read the report, I mean, I thought there were some absolutely fascinating facts and insights, and I want to concentrate on those areas which resonate most particularly with the program I'm involved in at the moment, which is the healthier working lives for older care workers. And particularly, I'm interested in how we recruit, retain, and motivate those so important members of the care community, because they're the ones with the knowledge, the experience, the wisdom, and all the rest of it. And I noticed that in the report you identified that there were 5 key factors to retaining adult social care. So, I mean, things like being paid more than the minimum wage, not being on a 0 hours contract, being able to work full time, being able to access training, and having a relevant qualification. That's a big sweep of things. What I'd like to do is get a sense from you of what you think is the most important of these factors, or how those factors stack up.
Yeah. So, and there's a lot more factors that we've got in the paper as well. Things like how close you live to your workplace, pension, statutory sick pay. Broadly, all of the factors can be grouped into 3 areas. One is around the quality of the role. So that's about your terms and conditions, your pay. The other is about your learning and development. Massive impact. If you train your workforce, they're more likely to stay. The more you train them, the more likely they are to stay. And the third factor is the organisational culture and leadership. So there isn't one silver bullet here. I know everybody wants one, but when there's about 16% of providers who have a turnover of under 10%, so that's quite low comparatively in our sector. And when we speak to those providers and say, well, what is it that you're doing differently? What they say is that pay does have an impact, but it's about living your values. It's about saying thank you to people, involving people in decision making, and investing in them and valuing them. So it's I would say the biggest thing that an employer can do to keep people. It's different to attract them, but to keep them, the biggest thing an employer can do is focus on making people feel valued, and think about the organizational culture. But that does include that whole myriad of people want stable work, they want good quality roles as well.
Yeah. No, it's really interesting. If I think back to, it's always interesting. You think about the exam question and you think about what you thought about first time round. 2 years ago, when we started getting involved in this program, I talked to a good chum of mine who knows this sector quite well. And he said, there's one thing, it's leadership that is the most important thing. And I mean, leadership is a broad sweep, but it captures a lot of what you've just articulated of how you bring values. And I mean, I'm a brand man, and I think having, knowing your values, knowing your purpose, being clear about your proposition is actually so important, because that's what attracts people to employment, and actually keeps people in employment, and not just in care, but right across the whole work spectrum. So
and social care is, the clue's in the name. It's social. It's all about relationships, and that's throughout every element of the role. And so relationships between your team is just so important, and between you and your manager. If a registered manager leaves, or you have an unstable registered manager, your turnover increases almost right away. And there's a reason for that.
Yeah. Well, I've always been told that you don't leave your job, you leave your manager.
Yeah, quite common to hear that.
Yeah. So just interesting, thinking about all these things that you've just talked about. Do any of those particularly resonate with more or less with older care workers? Things like qualification might be more important than pay, or whatever.
So interestingly, we looked at this when we were looking at the variables, particularly around pay, and there wasn't much to see. There wasn't much difference. There's some research that shows that when you take a broader look at your, for want of a better term, your compensation package for your workforce, then some compensation choices are impacted by age and demographics. So things like older people are more likely to value more money going into pension than a one-off bonus or a small increase in base pay.
Sure.
And so the biggest piece of advice I would give to an employer is be really clear who you're trying to attract, and think then about how you're shaping your package and your offer and your channels to attract those people. You know, for employers who are trying to attract younger people, for example, I have to break the news that nobody under 30 uses Facebook, and so you're not going to get anybody under 30 if you're using Facebook. So there's the biggest message, I think, is being very clear what demographic you're most likely to attract. I mean, obviously, you want a diverse workforce, but then shape your compensation and shape your channels around that.
Sure. So just to that point, I was one particular thing I was interested in, where you were talking about one of the factors being able to work full time. In a lot of the ethnographic work that we've done, we found that for older workers, greater flexibility in work patterns and shifts is actually more of a key factor for older workers. They're juggling children. Often they've got older parents that they're looking after, etc. as well. Is there any evidence you found that that's the case?
So it's really interesting, John, and we often get this this challenge that what we hear is that one of the things that people really value about working in social care is the flexibility, but then you have this this really clear link between 0 hours contracts and higher turnover. So what we know is that 0 hours contracts and in unstable work is a really big factor in turnover, and it's often because of, well, where does the power sit with the individual? If somebody has requested 0 hours contracts and that fits in with their life, then usually that's completely different. That's really welcome. Where it's imposed on them and it's a proxy for no stability in work and no guaranteed hours, then that's where it starts to impact on turnover. We've heard of providers recently trying to bring in different initiatives to get that balance right between stability and flexibility, because that seems to be what people want.
Sure. Okay. All right. So Oonagh, take this the right way. I'm going to be a bit blunt, but some people might argue that a lot of what you've said is, and there's in no way am I trying to decry it, but it's pretty obvious. But it's clearly very hard to implement. So why do you think that is?
I mean, none of it is a surprise, I would say. It is all common sense. Although there are some elements like training and having qualifications, which I'm not sure that people really do realise the scale of the impact. So if somebody has more than 30 incidents of training, turnover reduces by 10%. That's massive. And so I think some of it is really obvious, but we value restating it, because sometimes when people are in the middle of running hard, they find it difficult to remind themselves of that big picture. And so what I think it does remind us is that while some of these things will cost more in the short term, actually we need to see that bigger impact and the drain that comes from being on that recruitment treadmill. So it's much better to keep excellent people that you have with the right values that you've recruited by investing a little bit more now. And I say that recognising that that's not always easy, and sometimes the financial challenges in social care mean that it's not possible, but it's always something to aim for. And just the scale of the reduction in turnover from 48%, if none of those 5 factors are in place, to 20% if they are, that helps to make the business case. And we still do have 16% of providers who have a turnover of less than 10%. So there are providers that are managing to do that, and that is through a really relentless focus on some of these factors.
Yeah, no. Well, it's quite interesting because we've worked with 6 care home groups across Scotland. So we haven't worked in England, but across Scotland. And we've often struggled to engage, not because they don't want to engage, but because of the relentlessness of the process. And a couple of people off shift, and and the whole thing falls apart. But I've been staggered at, for instance, some of the the delays in recruitment, the waste of time that happens in recruitment. And I think a lot of it's down to a lot of what you're saying, which is about relentless focus, clarity on who you're looking for, clarity on the communication you're making, clarity on the medium you're using to get to those people. And I'm sure there's an awful lot that can actually be done to help make a big change in that. Just for the last bit of our chat, I'd quite like to focus a bit on older workers, just because that's what we're particularly about. And I wondered whether there were because the churn, and just for people who don't know that, the churn means the rate of people going and new people coming in. The rate of churn is actually quite low in older workers. Is that a good thing or a bad thing?
So it's neither a good nor a bad thing. It really depends. Having no churn is a bad thing, we know, because some people will make a choice that they're leaving the sector because they don't enjoy the roles, and the roles aren't right for them, and we definitely want that. But broadly, having lower turnover is a positive thing, because it reduces the disruption of churn. And I mean that in two ways, really: the disruption for the employer, but also the people that we support. I've spoken to a young woman whose son had 153 carers in 1 year. And I don't know how we can build relationships with the people that we support if you're getting two people more than two people a week. And so it really is that focus on experience, on relationships, keeping good people. So we want churn to be the lowest it can possibly be, while still allowing people to move to other organisations because they get a promotion, or to leave because they realise, actually, this role isn't for me. We want people to self-select, but we want turnover to still be as low as it can possibly be, sort of allowing for that sort of healthy moving on.
Yeah, good. So one of the things we found really interesting is that intergenerational working could be a positive symbiotic force. Different age groups helping each other in different ways. Do you think older workers could help to reduce the larger churn that happens in under 30s? Is there something more active, more proactive that we could do to encourage that?
I think there's loads that we can do. So your point about intergenerational working, we want adult social care, we all do, to be a rewarding career for all age groups. It's going to help with capacity in social care, and it's going to make sure that the people we're supporting, many of whom are working age adults, that they are supported by a diverse range of people. We know that older workers can and do help attract different age groups. So one of the biggest factors impacting whether someone comes into adult social care is whether they've come into contact with adult social care before at some stage in their lives. So even in my own background, my stepfather came into contact with adult social care when my mother was in a hospice, and when she died, he then went on to work in adult social care because he really enjoyed the interaction, and he enjoyed the work. And so the more that we can have people come into contact with others who work in adult social care, the better. So older workers, well, we all have a recruitment role, and thinking about how we use our role models nationally and locally is really important. But we also know the impact of some of our more senior, more experienced staff on turnover. So I talked earlier about your registered manager. If your registered manager is stable, then your turnover is generally stable. And so using and the experience that we have with our more experienced worker to support younger staff, possibly newer staff who maybe haven't had a lot of life experience, maybe haven't lived alone, and they're supporting other people with bills, for example, and they haven't necessarily ran a household. So there's a lot that we can share across the generations, and we know that people really enjoy that. They enjoy passing their knowledge and skills on to newer people coming into the workforce. So it's a bit of a win-win.
Yeah. No, good. So, Oonagh, we could talk forever, I suspect, but I know your time is quite tight. So, maybe just to finish off, you talk about in your summary that following on from this report, you're going to be leading the creation of a new workforce strategy to help tackle the challenges all of us face and to help identify some of the solutions that we could commit to. Could you give us some indication of what that might look like? Is there anything that any of us can do to help? Because I think we're all in this together. And what sort of timescales will you be working to?
Yeah, so we are going to work with partners to develop and lead a workforce strategy for adult social care, which is going to look for the next 15 years. It's very early days. The steering group hasn't yet met. It's going to meet next week, but there's going to be loads of opportunities for people to get involved. It's going to be a really wide open process because we need all of our brains on this. The timescales are relatively tight, so we're hoping to publish next summer, which gives us a good 8 months or so, 7-8 months. So just watch this space. We'll be putting out a load of opportunities for people to get involved. In terms of what it's going to cover, this is always the risk with a strategy, isn't it? You announce the intention to develop a strategy and everybody says, what's in the strategy? The driver for it is really some of the stuff that we've been talking about. We're going to need more people. We don't have enough people today. And this is an opportunity for, 440,000 people to work in excellent roles over the next 15 years. So how do we get them and how do we keep them? So that's basically the challenge that we're setting ourselves.
Okay. All right. Well, let me this wasn't on the sort of draft I sent you, but I'm just taking the opportunity. I mean, from your particular perspective, what would you think maybe the 2 or 3 big changes that are going to happen in the next 10 to 15 years that need to happen for the care system to be successful?
Some of them we've talked about today. I think the first one is we need to completely reframe how people think about and see roles in social care. I was speaking to somebody from a health role a couple of months ago, and they were saying, but after COVID, people do see social care as different. It's come up in the public consciousness. And I asked her, are you speaking to your grandchildren about coming to work in social care? And she said, oh, no, I'm speaking to them about being lawyers or working in health. And so we still haven't got there yet in terms of how we speak about and think about social care, not just as a drain and a problem to be solved, but actually a part of prevention, a part of personalisation, and a part of supporting our well-being. So I think we need to do that.
The real career opportunity.
Yeah, I think we need to see this as an opportunity, and we have a lot of other sectors that are reducing. Social care is not one of those, and so we need to be telling people, if you work in social care and you enjoy it and you're good at it, there really is a job for life, because this isn't going to be a sector that's going to reduce, and that's a really positive thing. So I think we need to do that. I also think we need to look at and really tackle both retention and new demographics. So we have a workforce that is only 19% men. And it's been 18% male for the whole time we've been collecting the data. It's gone up by 1% because of international recruitment. And we know that there are a lot of men being supported by social care. And so we need to attract new demographics, and we need to keep people. And if we manage to do that, to really value people in role, explain better what these roles are and how valuable they are, I think we'd notice a massive difference. We know that technology is going to have an impact as well, and there's opportunities for new roles in technology, and that's all sort of feeding into the positive story, I think.
For sure. It's really interesting. So I need to be careful about the way I articulate this, but there's a cultural element somewhere here, isn't there? In Britain, somehow we haven't got the cultural idea that caring for people is necessarily a good thing. Whereas I was visiting somebody in hospital recently, and the whole bunch of people from the Philippines who were on the nursing and caring staff, and we were just sort of chatting to them, and it seems like there is a family cultural, national cultural element about the Philippines that makes care and nursing and the whole thing such a wonderful thing. They really love it. And we somehow need to get that sort of element across in the UK.
Yeah, I think we need to, when you look at people working in adult social care, they're more likely to stay than other similarly paid roles. And why is that? Well, it's because they love the roles. And we do have this persona of care being low skilled. These are such skilled roles. I mean, when anybody who's come into contact with anybody working in social care knows that. We also, even though we only have 19% of the workforce as who are men, in absolute terms, that's double the number of men working in the whole of the armed forces in the UK. And so there's some of these, because it's such a big workforce, sometimes things can get lost, but we've got to keep telling that positive story.
Yeah, we do. Good. Well, look, thank you, Oonagh. Thank you so much for talking to me this morning. I really enjoyed it, and I hope maybe we can talk again.